Thanks so much for joining us for Healthline 3. I'm Wendy Redman. With spring ending, it means it's also time for summertime injuries. Joining us now to talk a lot more about that, we have Dr. Paul Bracey of Urgent Care of Louisiana. He'll be answering all of your questions about summertime injuries for the next half hour. We want to encourage you to ask all of the questions on your mind. If you're online, just fill out the information screen and submit it, or you can give us a call. That number is 318-219-4569. We're going to be taking all of your questions until 12:30. So first of all, doctor, let's go over what are some summertime injuries.
Well, as we kind of alluded to a little bit earlier, the more common summertime injuries are cuts and scrapes, as well as burns and even animal bites. So we kind of concentrated on those initially.
Right.
Cuts and scrapes, you know, kids are out of school, parents are working in the yard, or out having fun if we can. So you just have more opportunity to get injured. You'll also see a number of orthopedic injuries kind of climb during the summertime as well, because we're out and about and having fun, but putting ourselves at a little risk.
Right. Well, sometimes fun can be a little bit dangerous. I remember being out as a kid, riding my bike and falling down and getting up, and and then you get all those scrapes. When you're a kid, it happens, right? So you just got to be ready for it as a parent. What would you say is the most common summertime injury you see?
The most common summertime injury we see would probably be the sunburn.
That's a good one.
I mean, maybe not considered quite an injury, but it is an exposure.
Right.
So I think the sunburn is probably the most common thing, and we all have experience with it. I think if any of us has spent any amount of time outside, we've all had one, and we know how kind of miserable it can be.
Oh yeah, and especially when you're a kid. Oh my goodness, it is.
Right.
Times 10. Whatever you feel as an adult, it felt like that times 10 when you were a kid. Let's go through them individually. Let's start off with a scrape. So what should parents do if they look over and they see their child has a scrape and they're crying and panic sets in? What do you do?
Well, it's not unusual that as a parent the panic sets in. I mean, you see your little one there crying and in pain and has an injury, and that kind of is your first gut instinct. But most of these things are minor. Most of these things can be handled in the home environment without seeking medical attention. Minor cuts and scrapes. The biggest, I guess, component of treatment for any breakdown in the skin barrier would be cleaning. Clean the wound, and it doesn't take a lot of fancy cleansers. It doesn't take high dollar kind of wound cleansers. A regular soap and water will go a long way towards cleaning a wound and cleaning the bacteria out, not only of the wound but from around the wound. So a scrape, the first thing is to keep it clean. You can use things like peroxide. My parents used to use that red stuff that stung so bad.
I remember that too.
But it doesn't have to be very painful. You can also use some of the sprays that have a little anesthetic or a topical numbing agent in it. So they'll kind of clean the wound as well as anesthetize the wound. Can kind of help the kid and the adult feel a little better.
Yes, keywords and the adult.
Right. Because kids aren't the only ones that get hurt.
Right.
I've been known to get on my kid's ripstick and hurt myself.
Oh my goodness. Well, we do have an online question. Brenda asks, what are the best items to have in your home to treat those minor injuries? So I guess we're kind of going over that a little bit. Are there any specific products you recommend? I mean, what about polysporin or?
Well, like I said, kind of cleaning it initially is the first step, and then making sure that you just keep it free of any contaminant or debris. Keep it free of any dirt, any further kind of contamination down the road as it's healing. Polysporin, Neosporin, those brand names, triple antibiotic treatments. I tell my patients that probably the best thing the best function that they serve is to help keep the gauze from sticking to the wound when you cover it. I'm not aware of there being any really good controlled studies that showed a lot of benefit from triple antibiotic ointments as far as healing time or prevention of infection. And some people will develop an allergy to those, so you do have to kind of be careful, and then that can kind of cloud the picture. Well, is the redness we're seeing infection, or is it allergy to the topical antibiotic? So you know, I tell people there's nothing. It's not really going to hurt them to use it. Some people really like those topical treatments and feel more comfortable using them. That's okay.
Yeah.
But probably not necessary.
Any tips for kids that are maybe a little bit dirty or a little hands-on? You know, like if you cut your finger or something like that, and then you keep getting the wound reinfected, or do you have tips for parents on that one?
Well, you're going to want to cover it, cover the wound. If it's an open wound, after you clean it thoroughly, clean it well, then cover that wound. Because I mean, your kids are going to want to get out and play again. As soon as the initial kind of shock is over, they're going to want to get out and do what they were doing again. And covering that wound is going to keep it from becoming contaminated with other debris. And then when each night or each morning, depending on your bathing schedule, pay special close attention to it and just clean it really well each time.
Okay, we have another online question. This one comes from Mark. Are there any signs to look for to detect a broken bone? Maybe if you're not sure if your child has a broken bone.
Well, I mean, the first and foremost sign is going to be pain. And so it depends on the bone, quite honestly. It depends on the location of the injury.
Okay.
But pain is going to be your first and foremost sign. If it's one of the larger bones, a visible deformity in the limb is going to be your other sign. But you can have, especially in children, you can have fractures that don't exhibit any sort of deformity. So if there is any concern about a fracture, you're best off getting it evaluated pretty quickly by a physician. Urgent care clinics, ours in particular at Urgent Care Louisiana, we have X-ray in-house and read those films in real time. So getting the X-ray, if after examination it looks like it's indicated, is probably an important step, especially in children, because they can have types of fractures where the bone doesn't actually completely break. There are a couple different kinds, buccal fracture, green stick fractures, that don't cause an obvious deformity in the limb, but still need to be splinted or have the movement of that extremity limited in some degree or another to maximize healing of that bone. Should you ask your kid, if you're worried about a broken toe, see if you can wiggle your toes? Is that a bad thing to ask? Most people with a minor fracture can still have movement. Okay. So it's not necessarily a determining kind of a factor. So if you have a broken, say, toe or broken finger, you still, depending on the severity of the break, you still will have mobility of the finger. It will just be with pain. Gotcha. We'll say for most broken toes, if it's not the great toe, the large toe, the big toe, then the healing is pretty much done by what we call buddy taping the toes together. So there's not a lot of science involved in that, or a lot of fancy stuff involved in that. So, but the big toe does, since you brought up toes, the big toe does form a unique kind of a situation. So that one does need to be treated and evaluated differently than, say, a pinky toe. Didn't know I was bringing up a unique situation. Some things you learn, right? I just remember as a kid, my dad would say, wiggle your toe if I hurt my toe, to try to get a good indicator. So let's go back to the scrapes and cuts. At what point should you seek urgent care? If you're thinking, we get home, we might not know if it needs stitches. Right. If there's any question at all, I think getting evaluated, getting an opinion on it from a physician is probably warranted. If there's any question at all, because if it is something that requires sutures or stitches, then there's a kind of a process involved that we as physicians take when dealing with these, and cleaning them out copiously is one of those, and then suturing the wound, of course, is the next step. And sometimes it can be difficult for parents to know. It can be difficult to look at that cut and go, well, does this need stitches or does it not need stitches? And it just takes that experience of having dealt with hundreds, if not thousands, of those wounds to know, okay, this one's going to need a suture. Okay. So if there's any question, if it's a particularly deep, obvious need for sutures would be if it's a deep wound. If the wound is open, if the skin is not approximated and not sealing, on its own easily. Right. If it's particularly deep, then those would need suturing, cleaning out first and then suturing. Gotcha. What about
antibiotics, or I mean, I guess that would be if it got infected somehow, or are there any medications that parents might use? I don't know, ibuprofen, does that help?
Well, yeah, they can help a lot with the pain. Most cuts only need ibuprofen or Tylenol for pain. Ibuprofen has anti-inflammatory properties to it that Tylenol does not, so it may offer some benefit. There's not really any specific information out there to that point, but theoretically it may offer a little more benefit than Tylenol itself. But most cuts, even if they're sewn, only require a little ibuprofen or Tylenol for pain control.
Okay.
You know, we anesthetize the wound when we're fixing it, cleaning it, and repairing it, and once that wears off, usually only those are needed.
Okay, we have another online question. This one, I believe, is from Tracy. Is it a bad idea for a child to pick a scab? Is it dangerous?
Well, it really is. You know, not only from reopening the wound kind of a standpoint, but from the introduction of bacteria. We have bacteria under our fingernails, you know, pretty much all the time, and children, you know, in particular, because they, you know, they tend to be doing things that promote them. Right.
Yeah, they're in the sandbox and stuff.
So yeah, it really is not a good idea to pick at scabs or pick at wounds. You really are risking introduction of bacteria and promoting a wound infection at that time. And so things to look for wound infection would be redness spreading from the wound, an increase in the level of pain or tenderness, and then a more kind of obvious sign would be if there's a purulent drainage from the wound, then that would indicate it's infected. So you don't want to pick at those wounds.
Yeah, might be tempting,
Leave them
but
alone.
don't do it. Just let them be. All right, we're talking about summertime injuries. If you have any questions for Dr. Bracey, you can call us at 219-4569, or if you'd like to ask us any questions online, you can. We're at ktbs.com, and you can just fill out the information there on the Healthline 3 form, submit it, and we'll get to it as soon as we can. And now let's talk about animal bites, because that was something that you mentioned. My goodness, what would you do if your child got bit by, say, a neighbor's dog or an unknown dog?
Well, it does make a difference if it's a neighbor's dog or if it's an unknown dog. Animal bites are kind of a special consideration as far as cuts and scrapes go. Most animal bites are going to be treated with an oral antibiotic from the get-go.
Okay.
Most cuts and scrapes are not. Animals, and humans included, have a lot of bacteria in their mouths, and when there's a bite, you introduce that bacteria into the wound, and so they have a high degree of propensity for infection if not well cared for. And even in ideal situations where it's copiously cleaned, antibiotics are initiated, it still has a risk of infection. So even when everything's done right, it can still become infected. So you have to really pay attention to animal bites. Now, if it's a neighbor's dog, the other thing to think about with animals, whether they're domestic animals or wild animals, is rabies.
Right.
So if it's a neighbor's dog, you can find out if the dog is up to date on their rabies vaccinations, and if they are, there's nothing to worry about. If it's a wild animal that's either acting unusually or was an unprovoked attack, then that raises the concern of rabies. And there are a couple of ways that can be determined. It can't be determined from the patient, the victim of the bite, but it can be determined from the animal. So usually animal control is involved if it's after hours. When we've worked in the emergency departments, have utilized the sheriff's office to kind of help us drive that boat, so to speak, and trying to figure out where we need to go next, how animal control needs to get involved. And one of the things they can do is just observe the animal if you've been able to catch the animal.
Okay.
If you've not been able to catch the animal and it was an unprovoked attack, or if the animal seemed to be behaving in an unusual manner, then that could be suggestive of rabies, and rabies vaccination would be indicated.
Okay.
If it's a wild animal, then you're probably going to get a rabies vaccine. Now, the rabies vaccine that's available now is not what our grandparents talked about with the umpteen shots in the stomach, I think is what my grandparents used to talk about. It's a simple series of 4 shots that's delivered much like a flu shot, has a similar level of discomfort like a flu shot, and typically given in the shoulder, is delivered on certain days spread apart, and overall it takes about 2 weeks to go through that course. It used to be 5 shots, but the CDC's kind of reevaluated that. Most immune responses in patients who receive it are adequate with just 4 shots, so they dropped it down to a 4-shot series.
Okay. Goodness. What about a snake bite?
Snake bites, venomous snakes, poisonous snakes get all the glamour and the glory. But non-venomous, non-poisonous snakes require some special attention as well. Snakes, much like cats, deliver a puncture as opposed to a tearing kind of a wound like a dog. And those puncture wounds can get infected. We typically will treat a snake bite with oral antibiotics from day 1 instead of waiting to see what the wound's going to do. Right. With if you cut yourself on the concrete and you clean it out well, then your risk of infection is low. But with a bite, snakes also, the rate of infection is higher. So we're going to clean the wound, start an antibiotic. Now, venomous or poisonous snakes fall outside the expertise of any clinic system and would really require an emergency department visit, because you're going to need to be evaluated by an emergency physician who has training and experience in treating venomous snake bites and using antivenom to counteract that. So, and there are other things that go into some blood testing that goes into that if it looks like an envenomation has occurred. So that's a little more complicated. It's going to require an ER visit. May even, if the envenomation appears severe enough, require a short hospitalization to continue to get antivenom if you are a candidate for it. So venomous snake bites are a little bit different animal, so to speak. And require a little more careful attention. And if there's any concern, it's probably best if you get bitten by a snake and you're uncertain, is it venomous or non-venomous, don't try to catch the snake.
Oh my goodness,
a lot of people
do that.
A lot of people do. I've had people bring them to the ER.
So they
in
can say,
styrofoam containers and say, "This is what bit me." Please don't do that.
You could waste a lot of time with that too, in case it is venomous.
You could, and if it's venomous, you could be wasting a lot of time that you need to. Essentially, the best thing to do is just get to the hospital so the observation period can begin, the wound cleaning can begin, the antibiotic treatment can begin, and if needed, antivenom can be given. So.
Oh my goodness, you could get bit again trying to get.
I've had patients that happened to.
Really?
Yeah.
Yeah. Okay. Well, we actually have another online question. This one's from Josh. For a very fair-skinned redhead, what SPF level of sunscreen would you recommend? So this is back to the sunburns. Right.
I would tell you that, I'm relatively fair-skinned. My children are too, and we, and my wife is as well, and we grab pretty much the maximum SPF. I will say that SPF 15 blocks about 93% of harmful radiation. SPF 15 is what's found in most women's cosmetics. It's found in some men's lotions. So it does block 93%, but it still takes that reapplication. I typically just go for the cost does increase with the higher the SPF typically, though honestly I'm not real aware of what that trade-off is as far as how much that lotion's going to cost compared to an SPF 30. But I would say at least an SPF 30. If you're a fair-skinned individual, you're gonna want and require probably the higher SPF. But again, probably the most important thing related to that is reapplication. You can't stress reapplication enough. So no matter what, even if you use an SPF 15, reapplication is going to give you more protection than using an SPF 50 and not reapplying. So reapplication is the key when using these sunscreens. And then if you're going to be out, wearing the other things that have been shown to help, wearing a wide brim hat. Wearing a wide brim hat has been shown to help reduce the rate of skin cancer on the face, the neck, the ears. Wearing a baseball cap is only going to protect the face, and to a small extent, because the brims are typically smaller than the brim of a wide brim hat. So using a combination of SPF and protective clothing, wide brim hats, clothing that has SPF built into them, or heavier clothing will go a long way towards protecting you against the sun's damage. I will say a white t-shirt has an SPF of about 1. So it really doesn't give you much protection. So you're going to want to use something other than just a plain white t-shirt if you can. And I know a lot of the swimsuits have the tops that go with them now. The boys' swimsuits, of course, have a top that go with them now that's has an SPF factor built into them. So that's especially if you have young children. And I will say, the younger the child, the more the less exposure they have to suffer sun damage or have a sunburn. And this goes especially true for neonates and newborns. You know, you really just want to keep them out of the sun altogether. Don't let them get in the sun.
Well, let's talk about the different degrees of a burn that you can get.
Well, burns are rated regardless of the cause of the burn, anywhere from 1st to 4th degree burns. First degree is a very superficial burn, only involves the superficial layers of the skin. There is typically no immediate blistering. First degree burns are what you typically get with a sunburn. So the treatment of the first degree burn is usually things like cool compresses on the burn itself. First and foremost, I guess, is just getting out of the exposure. You know, if you feel the burn coming on, get out of the sun. Get into a shaded area or go indoors where there's air conditioning, kind of cool off, drink some water. When you get inside, you can use something like aspirin or ibuprofen to help with the pain as well as the inflammation of the burn. Typically, I like ibuprofen personally. Everybody has their different choices, but all of those are pretty much created equal, other than aspirin, as far as their ability to fight inflammation and things like that. Aspirin's a little more unique, but can be used as well. And then you can use topical preparations if they have camphor, menthol, or the lidocaine sprays that we kind of talked about related to burns. The camphor, menthol, lidocaine combinations can help with the soothing and the healing of the burn. Aloe vera can be used as well. It can be kind of soothing. Things that have ointments or lotions that have aloe vera in it can make it feel better. You know. What
should you not put on it?
Don't put anything that is going to be kind of caustic to the skin. Don't use alcohol. Don't put any kind of a breakdown. You don't want to use a lot of alcohol on. You don't want to rub down with that to quote cool off. It's gonna generate a lot of pain. You really want to try to stick to just the camphor, menthol, lidocaine kind of topical treatments. You don't really need to use something like Caladryl or anything like that. It really won't give you much benefit.
What about, should you take a hot shower or a cold shower after you get a burn?
I definitely would not. I would definitely would not take a hot shower.
Or
it's really more a matter of comfort. It's not really so much a matter of burn treatment.
Okay.
But the cool water will feel better. It doesn't really. You know, there's a myth that you want to take the heat out of the burn, and so people will use butter on a burn, or they'll use other kind of refrigerated products on a burn. The damage is done. It's not an ongoing thermal injury, so there's not a, you know, the goal is not to pull the heat out of it, really, so to speak. It's just a matter of making it more comfortable. So I would if I'm going to take a shower afterwards, I would take a cooler shower, because a hot shower is just going to hurt.
Feel better.
And there's no benefit to the hot versus the cool. Yeah.
Gotcha. Well, actually, would a hot shower be worse, even if it feels comfortable on you? Will it dry out your skin more and therefore have that effect?
Yeah, you know, taking a hot shower does strip the oils off your skin. Now, with a burn, you're already injuring some of the, depending on the depth of the burn, you're already injuring and impeding some of the oil producing properties of the skin. So if you're stripping that off with hot water and soaps, then you are losing some of your protection, some of your skin protection, and can lead to drying of the skin, which can make the itching worse, can make the scaling worse. So yeah, I would avoid a hot shower.
A lot of old wives' tales out there. I remember when I was a kid, I used to get the worst burns. I mean, I still can, but when I was a kid, oh my gosh, it was horrible. And I remember my mom saying, "Oh, we should put her in a bath of oatmeal." Does oatmeal help?
Well,
I didn't actually do it, by the way. Let me just say this for the record. That did not happen, but she mentioned it.
I'm not really aware of there being any benefit to oatmeal in a burn situation. I will say there are some instances where oatmeal is used, like with eczema. but in a burn, I don't think the oatmeal is really going to benefit you much. Now, I mean, they do make some of these over-the-counter kind of oatmeal bath preparations, like a Vino oatmeal bath, that are colloidal oatmeal, so you're not pouring, Quaker in the bathtub. But and I mean, anecdotally, those do seem to help in cases of like eczema and dry skin scenarios. But I'm not aware of there being any studies that show that there's a benefit with burns.
Okay, we have another online question from Vonda. Any products you can use that could eliminate the scars burns leave behind?
Well, burns are kind of a special scenario compared to, say, a cut. Now, with a cut, there are some products that you can use that can help reduce scar formation, but they have to be used for a period of at least 6 months on a daily basis. So there are no short-term benefits. Whenever you have a wound, that wound is going to continue to remodel for the next 6 to 12 months. So whether it's a cut and it's sutured, or whether it's something that you scrape and leave a little bit of a scar, or even a burn, that skin is going to continue to undergo what we call remodeling for a 6 to 12 month period of time. So when you look at scar formation, you look at trying to help and minimize scar formation, things that like vitamin E ointment, it's an antioxidant. You can use things like Mederma, it's over the counter. They can help. The degree of benefit is going to vary depending on the cause of the injury to the skin. But burns are kind of a unique situation where a lot of the apparatus underlying that skin has been, depending on the depth of injury, can be destroyed. Now, a first-degree burn will typically not leave a lot of a scar. I will say in some darker pigmented people, you will see a difference in the skin pigment. So the skin pigment will change over that scar, and with accumulated sun exposure in sunburns, that can become more of a permanent issue. So you can have a permanently discolored area, and there's not a lot that you can really do to prevent that, or to try to change that over time. But for like cuts and scrapes, you can use those. The other thing that will really affect wound remodeling is ultraviolet radiation. So going back to preventing that burn and blocking the ultraviolet radiation, and most products now that do the best job are either I think it's a titanium dioxide or zinc oxide preparations. And they're not that big. You see the lifeguards with the white stuff on their nose, and it's that same material, but it's blended in what are called nanoparticles, and so that it doesn't leave you that white shiny thing. It looks more, it blends in better, so you're not just covered in a white paste. Okay. But things like that will help go a long way towards minimizing scar. Blocking that sun from hitting that scar is probably one of the bigger things that you can do to minimize the scar formation. Okay, so we talked about picking your scabs and don't do it, it's not a good idea. What about peeling your sunburn? Well, peeling your sunburn, a first-degree sunburn, that's superficial layers of the skin, so it's not penetrated down through the dermis and into the subcutaneous tissues. So peeling your sunburn really probably does not increase your risk of infection significantly. It's going to peel whether you pull it off or not. If you, and I would say we've been guilty this summer already. One of my sons has already had a sunburn, and he's doing that himself, and you keep telling him stop doing that, but it really, peeling off that very superficial layer is not going to probably increase your risk of burn. If it were a deeper burn, if you're talking about more of a thermal injury burn as opposed to a sunburn, then it may. If it's a second degree, third degree burn, then yeah, peeling off those blisters can increase your risk of infection. The second degree burns are the ones that you can still feel, that have the blisters on them, and we'll typically leave those blisters intact as long as they're not too much in the way and risk of just rupturing on their own anyway. If it's on somebody's arm and they're constantly doing this, then they're going to pop that blister themselves, and it's probably better in a controlled manner with wound care applied than it is in an uncontrolled manner without that. But so in those cases, we say don't penetrate the blister. Try to let it go through its natural course. But for a superficial sunburn, it shouldn't increase your risk of infection.
Okay. Well, Dr. Bracey, thank you so much for being here with us today. I'm sorry we're all out of time, but that was a lot of great tips you had to give, so we do appreciate that.
Well, thank you very much.
And thank you for joining us. We'll see you right back here next time for Healthline 3. Have a great day, everybody.